And now, since our brains are all ready, let's bring up our keynote speaker. We are thrilled once again to have Dr. Hemant K. Pandey join Aging Made Easier. Dr. Pandey is a board-certified neurologist and sleep specialist with more than 20 years of experience in neurological research and treatment. Dr. Pandey is dedicated to advancing patient care through cutting-edge research. Aside from his neurology practice, the Brain and Spine Center, he is owner of Chandler's TrialSphere Clinical Research, formerly MD First Research. TrialSphere Clinical Research is dedicated to advancing medical science while expanding patient access to innovative treatments. Research participants benefit from access to cutting-edge therapies 2 to 5 years before public availability, comprehensive study-related medical care at no cost, and reimbursement for time and travel and continuous clinical support. Dr. Pandey has been very generous with Neighbors Who Care and has been sharing information with our audiences for a few years now at the Aging Made Easier conference and our summer speaker series. And he's been a guest on our podcast as well. Please give your attention to Dr. Pandey.
That was beautiful, Erica, the opening. My middle son does meditation, and this is part of the sensory meditation. So whenever he's presenting, it's the breathing and then the 5 senses that we indulge in. There's actually a really good book written by a monk, Sharon Lukert. She talks about how meditation is important for memory difficulties. So she now has mild cognitive impairment, which is the earlier form of memory loss, and she uses meditation. The reason meditation is important, before I go on to my talk, is you will all notice that when you're anxious and when you're frustrated, the memory gets worse. So you're trying to find a word, you're trying to get a name, and when you are overwhelmed, that access to information gets really harder. That's where the meditation, the breathing, the sensory meditation kicks in. So I think this is a beautiful way to start the presentation. I have to validate myself. I have to tell you who I am. I've been in the Valley for about 15 years, 20 years of neurology practice. And I was a stroke director at Chandler Regional, and that's where I learned the power of community and the power of the organizations that work in the community. When we were implementing the acute stroke program, I realized that I could not develop the program of telling people what acute stroke is, what a clotbuster drug is, until I worked with the community. So we worked with the EMTs, we worked with local organizations, and then I got to know how powerful the community in Chandler is. About 10 years ago, I moved into the world of memory loss or dementia. We had a first drug that came in for evaluation for treatment, and that's when we started our research program about 10 years ago. So it's been an amazing journey. Now I have 3 companies that have enslaved me. I work for them, voluntarily right now. One of them is my practice. My practice has moved into cognitive neurology purely in the last 4 or 5 years, and we have been doing research for the last 8 years. The research used to be, a thought of experiment where you would be given a drug that you don't know about, but the world of research has really moved. There are 3 ways to look at a care. One, primary prevention, secondary prevention, and when an event happens. So you have an event, you have a stroke, you have a memory loss, you get treated, it's too late. Okay? You are at risk for stroke, you are at risk for memory loss, and that's secondary prevention. The primary prevention is you are not at risk, you don't have any risk factors, but what do you do in your lifestyle to prevent the cognitive impairment from happening? And that's what we will be talking about predominantly today. And so the research allows us to do primary and secondary prevention. In the world of research, we now have biomarkers which are available to patients for earlier testing. We are able to provide them treatment which are yet to be validated by FDA and brought in the market. For example, we have tau drugs that we are studying this year, probably will come into treatment in about 2 to 3 years. We have amyloid drugs that we've been studying for 4.5 years, which are now being used. So all the talk or the conversation today is coming from this commission called Lancet Commission. So Lancet Commission is a group of large neurologists or cognitive neurologists, Dr. Jeff Cummings from Nevada, and they come up with guidelines that talks about what are the lifestyle measurements that you can do to prevent memory loss. You'll see the term used is dementia. It's not specific for Alzheimer's, but Alzheimer's is the most common cause of dementia. For many of you that are hearing me talk for the first time, dementia is an umbrella word. There are multiple types of dementia. The most common form is Alzheimer's. So when a patient with memory loss has balance issue, that's vascular dementia. When a patient has hallucinations, that's Lewy body dementia. But when a patient has difficulty with short-term memory, not able to remember words, executive functioning, driving difficulties, mood irritability, that's Alzheimer's dementia. So we'll be talking in general about what are the things which are important, not just for someone who is at risk, which is secondary prevention, but for everyone, for all of us, in terms of what are the modifiable risk factors. We had 14 modifiable risk factors as of 2024. There are 2 more that are added last year. So the risk grows. I used to think, my practice was the thing. Patients would come in, we would make a diagnosis, we would give them medications, and then they would leave the office or they would leave the practice. I didn't realize the power of what Cheryl does or the power of the community of how important this is in the overall health of the person. And I now realize, and I tell my patients, that I'm probably doing 15% of the job. 15 to 20 or 30% of the job is my office staff, and I think the 70% of the job is done in the community. The good news is we have now validated it with research trials, right? So when Steve Jobs presented the iPhone, it was a really interesting moment. He said, a device that gets you music, a device that you can talk to, and then a device that does internet. And then he kept saying that again and again until he came out with the iPhone. So I think 24 and 25 has been the most fascinating years for patients with memory loss. Number 1, we have a blood test that's able to detect patients with memory difficulties 15 to 20 years before the symptom starts. We have biomarkers that are now approved by Medicare and are done in the practices, such as a spinal tap and a PET scan, that can detect the disease 10 to 15 years early on. So a blood test. Second, we have 2 new approved treatments that are FDA approved, covered by insurance, that can remove the plaque from the brain and that can prevent a decline. 50% decline from going from early to mild stage and 50% from mild to moderate stage. And number 3, this year we validated how powerful social network and community work is and why prevention works through a trial called Pointers Trial. So I'm not as good looking as Steve Jobs, but I think I can repeat the 3 things. Number 1, a blood test. Number 2, a treatment. And number 3, the power of the community and the power of the prevention. And that's what we'll be talking about today. What do you need for that? Well, you need 3 things. 1, you need the information, and I'll be giving it to you. Second, you need the inside motivation to make sure that this is doable. But the last thing I think, which is we are lacking right now, is the right physician partner or the right caregiver partner. This is a very brand new world. Everything that I'm talking about today is just recently published, is just getting into the healthcare. So the primary care physicians or the practitioners might not be completely on it. I think it's your job to bring the information to them. So the first thing, it's never too late, right? The dementia modifiable risk factors are broken into 3 different stages. What can you do when you are in the early stage, high school, college, and the early years? What can you do in the middle stage of life? And what can you do in the late stage of life? Every year, the trajectory for me is shifting. My patient population 4 years ago, average age was 72. My average age right now in the clinic is 87. So when I see a patient who is 75 or 76, I say, you're very young. Why? Because you have 18 years to manage your life. If you look at the longevity of how long your parents lived or your grandparents lived, then you're going to say you're 18 years. And some of them will come back and tell me, I'm going to live longest in my family. So then these things become very relevant. So even though the Lancet Commission breaks it into 3 different categories, I don't think they specifically relate to each specific stage. This is the bar that talks about the process of Alzheimer's starts 15 to 20 years before the symptom onset. So if you see that shaded line, beyond the shaded line is patients with clinical symptom. Way ahead is patients who don't have clinical symptoms, but who are at risk. That gives us 15 to 20 years to intervene or to take care of our lifestyle, things that we can work around us to prevent any kind of cognitive impairment. From the yellow bar onwards is how the medical community was diagnosing patients with memory loss. I frankly don't like the word dementia. I'm working with a partner in Utah to change the word D because dementia comes from the word dementor, and I don't think it's appropriate. I think cognitive impairment is the right way to use the terminology. So the term that most physicians use is mild cognitive impairment. Mild cognitive impairment means you have a cognitive issue, but you can function. You can shop, you can travel, you can independently do your taxes. You just need some help. Maybe your wife nudging you saying, this was supposed to be a right turn, or like, honey, it's time to pay for the taxes, or things like that. And patients brush it off, but it's not a good idea to brush it off. The new term is called preclinical AD. That's appearing in that blue box that you see. What preclinical AD means is I don't have symptoms, but I have biomarkers, and I'm at risk, right? And these biomarkers are the blood tests, the spinal fluid, and the PET scan. The duration is not very appropriately shown in the graph. So preclinical can last for 15 years, mild cognitive impairment for 5 to 7 years, and then the dementia around 5 to 7, and then late dementia can be 10 years or onwards as well. Okay, so what are the risk factors? Let's talk about them. It's kind of broken like this, okay? Just because a graph is, or a circle is bigger, doesn't mean that it has a higher proportion. It's just 7% is more than 1%. I had a patient of mine who was looking at it and he said, well, only 1% is alcohol and 7% is hearing, so I can drink. I said, no, that's not, that's not how this graph is meant to read. So in the early stage, it's education, right? So it's important to have education, not necessarily a formal education, but any kind of education. And the reason that's important is because the term is cognitive resilience. If you're able to, have enough neural pathways in your brain to deal with any kind of memory loss, you're not going to show symptoms. So people who are educated, people who have worked higher, they are high school, they're business owners, they tend to not have as much of memory difficulties, right? There's a problem, though. People who are high cognitive reserve, I see a lot of professors from ASU or physicians, they present later. They present later because they are compensating for their difficulties as the difficulties come to them. So if I start to know that I cannot see 20, 25 patients, I'll make more post-it cards, or I'll make more reminders myself. So I'll compensate until I cannot compensate anymore. I do think the bucket about education in early life is not accurate. I think education at all stages is very critical. We know that learning a new language is one of the best ways to prevent you from having cognitive impairment because you have the maximum neuronal firing. And then there are the risk factors that you see identified, which we'll talk about it, and then there are late life factors. The two new factors that they added last year is actually very interesting. One of them is called financial shock. So if you lose 70% of your retirement fund, that's now considered as a risk factor, for memory loss. So be very careful. It's not a bad idea to stash money under your bed. And okay. And so in 2024, the two new discoveries were vision loss and LDL. Right? The number for LDL keeps changing. We started with 130 10 years ago, then we went to 100, then we went to 70. I don't know where they'll stop, but they keep pushing it down as much as you can. So LDL is a risk factor. Vision difficulty is also considered a risk factor for dementia. So if you're developing cataract, glaucoma, take care of it. Okay. 3 new things. I just have one slide for all of them that's happening. One is Ozempic or semaglutide. We are thinking, or we know that the GLP agents are very good for cognitive impairment. The data was presented in December and unfortunately did not have a good outcome. Of all these numbers that I had, the slide is slightly old. The 7,600 patients that they had, they did not show any improvement in their memory and functioning, but, there's a big but, 18% showed that the biomarkers declined with the use of semaglutide, right? And it goes back to tight glucose control inflammation. That's the first thing. We'll have a lot more information coming in this year. Second, lithium orotate, not carbonate. Lithium carbonate was the drug we used for patients with mood disorder, bipolar, but lithium orotate is now beginning to show some benefit in cognitive impairment. There are 3 papers published. My take on it, I am not recommending it to everyone, but if I have a health enthusiast that comes and he's bouncing off the wall, I'll tell him the dose to take, okay? So that's the thing. And the third thing, shingles vaccine. So we'll have a lot more data on these 3 things in the coming days. Education, we talked about it. We also talked about the cognitive resilience. Hearing loss, huge thing. I think, we have a vendor over here. I would highly, highly recommend, taking care of it. Most of the patients that come to my office don't have the hearing aid with them, and it's the spouse that, typically guides me through it. So I think hearing loss is important. Mood and depression, that actually can be one of the presenting signs for patients with cognitive impairment. And then TBI, which I don't think you guys are roller skating at this age. So these are the three risk factors that need to be addressed: a really tight LDL, really tight control on blood pressure, and the really tight control on diabetes, which is where the semaglutides come in. Smoking, typically I don't see that in my population in the practice. Now alcohol, the sad part is no alcohol is recommended as of 2024. Not even a small ounce, and I'm very sorry about that, but it comes from Dr. Cummings. Physical inactivity, we talked about it. And the social connection, we are learning, specifically from COVID, that what we are doing is very important. So you getting involved with the church, getting involved with the local community, there is something that it does to the neural circuit, which is very, very important. So I highly recommend Neighbors Who Care, Hospice of the Valley, Oakwood. I have a whole bunch of people that I work with. Central Arizona Agency in Casa Grande. We are part of about 14 memory cafes across the place. Get yourself involved, learn something. Mood and memory loss, we talked about it. And then air pollution is not necessary over here, but air pollution was also a risk factor, that was in 2023. Too small to read, sorry about that. Okay, now the thing is, how you can come back to say, I don't trust you. How do I know what you're saying works? And that was the third aha moment of, Steve Jobs. We had a trial called Pointers Trial. And the Pointers Trial concluded their data and presented in July or August of 2025 at AIC. I was there, and it actually shows that you can change your risk factor. Remember, 50% of risk factors are modifiable. It doesn't matter what kind of gene do you have, you can modify them with what we're talking about. This is the US Pointers Trial. I would highly recommend you look at it. And it was done predominantly to see, does these measures work? So they took about 2,000 patients across 5 different clinics in US. This was already done in Europe through a Fingers trial, but they did the Pointers Trial. And they took patients who are 60 to 79, relatively healthy individuals, who have a good, healthy life. They don't exercise as much. They don't eat as healthy, so there's hope for me. And they said, how, are they going to improve or not? So the actual population was, these patients were not very active, about 60 minutes of exercise. They had some room for improvement. They had some risk factor. And they said, okay, we're going to put these patients into 2 different groups. One, you do it by yourself. Second, we'll give you an expert that will guide you. So a lot of patients tell me, I exercise, I am a really healthy eater. So this was a really big surprise for me, that with the guided help, they focused on 4 things: physical activity, mind diet, which is the nutrition diet for dementia, cognitive training, and social engagement, right? So people met about 38 times over the 2 years period to make sure that they were compliant. And they had baseline testing, and then they had testing after 2 years. And here's a surprise. You pay for an expert, you get the results, okay? But find the right expert, I think. So you can do it yourself, and I think everybody got better, which is a great news. But I think people who had guided help, they really, really improved. And how did they improve? They improved on planning, organization, sustained focus. They improved on decision-making, multitasking, and problem-solving. So these are the domains that really help. So everyone that you're seeing around you, I think will get you to that 95-100, and you'll still be able to drive around Chandler. So I think, is the approach safe? As you see, we are not intervening with any kind of pharmaceuticals. It's diet, exercise, cognitive therapy, and it's socialization. So diet is a mind diet. We have a nutritionist in our office. For a lot of you who are interested, look up Mind Diet on Google. For a lot of you who are really gung-ho, you can look up the Bredesen diet. That's called End of Alzheimer's. It's not very validated, but I recommend it to people who are looking for it. For exercise, this book actually comes from Dr. Fang Yu. She's part of ASU. We are doing an ASU trial for them for a specific exercise program for cognitive therapy. Social connection, Cheryl is right here, leading the pack over here. And then cognitive therapy. So the app is called Brain HQ or Luminosity. But if you really want to notch it up, you want to find a cognitive therapist. We have a cognitive therapist that we just started in our practice. The good news is, even if you have bad genes, like the ApoE, these results still help out, okay? So clear your schedule, track your progress, the Oura Ring, the Apple Watch, anything. I think it's really good. I didn't talk much about sleep because it was not included. Get a professional coaching, at least know what your areas of weakness and strengths are, and then get going, okay? So the pointer study was really, really helpful. So going back, we have an early detection blood test that the physicians can do. We have 2 treatments available, and we have proven data now that everything that Cheryl is going to be talking about today and her package actually works from a data-driven part, right? Cool. I think that should be it. I have a few minutes. Cheryl said I can take a few questions. Yes. You'll have to yell from there.
What do you think of taking creatine?
I think there's a lot of nutritional, things outside, Prevagen, Ginkgova, creatine. They have not been validated scientifically. The number of data there is not helpful. Creatine, you got to be a little careful because it's a protein, goes through the kidney, so you want to be talking to your doctors on that. Yes. Yes, go ahead.
Is there a book for the Mind Diet?
So the Mind Diet actually is a very good diet on, I think, there is no book on it, but if you type up Google, it specifies everything. How many berries, how much is the red meat, and all that. Essentially, it's, 2 major things if you want to start. One is no sugar, and the second is intermittent fasting. Because when you fast, you create a ketosis, but you can get on that Mind Diet. I do recommend getting a nutritional consult. It's always a good idea to know your body type and to kind of work with it, okay? Yes.
Second last screen, the weekly checklist, or where can I find that?
Okay. You'll have to pay me for that. I think they removed my slide. I will make it available to Cheryl, and then she can share the details. There's a whole list on it. The question was, where is the checklist, and can she get a copy of the checklist? Okay. One more maybe, right? Okay, good enough.
I heard about the test. Oh, sorry. I understand that there is a new study of using embryonic fluid that have had from like the first trimester of babies that has been treated for Alzheimer's. Do you have any information on that?
I think, the closest I can think of that is a stem cell. I think, there's a lot of work happening in the treatment. Right now, the focus is on removing the amyloid, which is the first stage. The second stage is removing the tau. Third stage is working on inflammation. So this is all inflammation. And I think the fourth stage goes back to turning the faucet off so that amyloid doesn't happen, right? So I will just take a few minutes to talk about why Alzheimer's happens with age. We cut a protein into 2 different splices, and the protein gets cleared off. As we grow older, the scissors get really blunted. So you cannot cut the protein very well, and you have a sticky part to it. And that's what creates the amyloid, that's what creates the tau, and that's what creates the process. So the risk of Alzheimer's is, 1 in 6 at the age of 80, 1 in 3 at the age of 85, 1 in 2 anything beyond. Now, what you're talking about is going even before the scissor cutting process to really turn the process off. And there's a lot of work happening on that. We have a trial right now for prevention. We have a trial right now for very early, that not just works on Alzheimer's, but also Parkinson's and Lewy body. So the work is happening, but the data is about 3 to 4 years out on that. Blood test is available. There are multiple practices that are doing blood tests as part of screening. The blood tests are highly sensitive. We offer that in our practice and also in our research. So I would really look up, and the protein is called p-tau217. I did not put that up, but that's it's a whole new talk. I'll have to move in with you. Okay, very good. Thank you so much. Okay, I think, take care.